that cardiovascular disease is the #1 killer among Singaporean women? 1 in 3 women dies of cardiovascular disease in Singapore, claiming more lives than breast cancer. Studies showed that heart disease is deadlier in women, often going undiagnosed or undertreated.
What do you think is the most deadly disease among Singaporean women?
Diabetes, breast cancer,
kidney failure.
Heart disease can affect women of all ages, and particularly after menopause. The good news is that heart disease can be prevented or managed if you take care of your heart health. Some risk factors include diabetes and pre-diabetes raise the risk of coronary artery disease more in women than in men. In fact, having diabetes almost doubles a woman's risk of developing heart disease. High blood pressure, also known as hypertension, usually occurs without any symptoms. Women who have high blood pressure are at an increased risk for coronary artery disease. High cholesterol also occurs without any symptoms. The buildup of excess cholesterol causes narrowing of the arteries, reducing blood flow to the heart. People who have excess body fat, especially around the waist, are more prone to developing heart disease and stroke. Overweight women are 55% more at risk of developing heart disease than men. Smokers have 2 to 3 times the risk of non-smokers for sudden cardiac death. Female smokers are twice as likely as male smokers to have a heart attack. Depression is twice more prevalent in women with heart attacks. Acute stress is associated with Takotsubo cardiomyopathy or broken heart syndrome, especially in women. Typical symptoms such as severe chest pain, cold sweat, and giddiness can be experienced by both men and women. Women, however, are more likely to exhibit atypical symptoms such as shortness of breath, back, neck, or jaw pain, fatigue, nausea and vomiting. Women are more likely to dismiss these symptoms and less likely to see a doctor when symptoms of heart disease appear. This causes delays in diagnosis and treatment. The Women's Heart Clinic aims to empower women to take charge of their heart health through greater awareness of their risk factors and symptoms. The clinic offers end-to-end services, from prevention to diagnosis, treatment and rehabilitation, customized to the specific needs of women. Once the patient learns what is the correct diagnosis and prescribed course of treatment, she can be a proactive participant in her own recovery to good health. Tips for a healthy heart: don't smoke. Exercise for at least 30 minutes, 5 times a week at moderate levels. Check your blood pressure, cholesterol and sugar levels yearly. If you have high blood pressure, high cholesterol or diabetes, take your medications and keep these conditions under control. Eat healthily by aiming for a more plant-based rather than an animal-based diet. Cut down on refined sugars, salt, and saturated fat. Pick up relaxation techniques, for example, meditation, breathing exercises, and yoga. Think positively to support a healthy mind.
The Women's Heart Clinic here at the National Heart Centre Singapore aims to empower all women to take charge of our heart health. We believe in holistic care of not only the woman's heart, but her entire physical and psychosocial well-being. In other words, a healthy body and a healthy mind support a healthy heart. And remember, a healthy woman means a healthy husband and family, which then means a healthy society.